Then the issues and challenges overall, if I compile them, that is involved in the organ donation is the high burden of the organ failure cases. This is the first issue, that already we have the high burden of organ failure cases. There is a high demand for the organ donation, poor availability of the donors, that is demand versus the supply gap is very huge. So we have the very huge space and very huge need to work upon these things. Then we have the poor infrastructure, especially in the government sector hospitals. As we already talked, that most of the hospitals are not doing or not involved in the organ donation purposes because of the poor infrastructure and the manpowers. Then the lack of awareness of concept of brainstem death among the stakeholders. They are not aware about the brainstem death. We can do donation with the help of brainstem death and all those rules. They are not aware and they don't want to go into this tricky part, and that is the reason also. Then poor rate of brainstem death certification by the hospitals. Most of the hospital, as I already told you, they are just certifying death certificate are being issued without any certification of the brainstem death. That has to be in practice for the normal cases as well. This is not for the transplantation purpose only. Then poor awareness and attitude towards the organ donation, poor diseased organ donation rate. Then due to the lack of awareness among the needy as well as the in general people, they are not aware much about the possibilities of organ donation and they can help people with the organ donations. So there is poor diseased organ donation rate. Even from the diseased person, many more things may be tried, many fluid, maybe the blood filtrate, maybe certain parts from the blood. That is a part of the research and innovation as well, that we may think of the many other things that may utilize from the body after the death, and that may be vital for a much longer period. There may be certain non-functional useful parts after the death that may be utilized for the donation purpose. These all are the part of the innovation and the research. That is the another factor where we need to improve our system. Then the lack of the organized system for the organ procurement from the deceased donor. As we already discussed, that there is no streamlined process where the particular organ who is available for the donation and who is needy, there is a huge connectivity gap, there is a communication gap, and the very limited hospitals are able to manage properly. These all are the lackings that is involved with the organ donations. Then reluctance of many states to adopt the THOTA Amendment Act 2011. This Transplantation of Human Organ Acts is not being implemented in the every state. That is another issue. Transplantation of donated organs, especially the interstate transfer. Different states have the different rules, so this is the difficulty. Then the allocation of diseased donor organs, especially heart to the foreigners. So here again there is no streamlined processes. Then the gaps in the data reporting, especially online entry by the hospital or the states in the national registry. That is another challenge. Lack of organized network system between the NOTO, ROTO and the SOTO. Recently this National Organ and Tissue Transplant Organization was developed, but still it is an evolving phase, and the coordination between the national, regional and the state organ transplantation organization is very poor and they have to be improved. Then maintenance of the standards in the transplantation, retrieval and the tissue banking. This is another next step, that what are the minimum standards and what are the background that should be available for the organ donation, the retrieval and the tissue banking, and the proper maintenance of the hygiene, because even after the transplantation it may contaminate with certain other diseases and other factors that shall be looked upon. There are the many challenges like this, that is the medical procedure related challenges. Then prevention and control of the organ training. The various laws has to be defined so that the organ training may be controlled, or if it is there then it has to be in the proper legalized system should be there. Then high cost, especially of the uninsured and poor patient. Organ donation is still very costly and it is to be brought down. This can only be done if we increase the donor pool and the government systems improve their hospitals or the institutes. They may advance themselves to provide those facilities at a cheaper rate. So this may be sorted in this way. Then regulation of the non-government sector is another challenge. This is non-government sectors are not properly regulated. So these issues and the challenges are involved with the organ donation system. Then the next question is, how can we increase the pool of the donors ethically? So the following steps may be followed. to increase the pool of the donor. One is the educate the mass. The more the educated and aware mass is about the organ donations, they will be more promoted for the organ donations. Then they will also be utilizing for their own purposes and their relatives. Then the mandated choice shall be made that it should not be the optional in case of deaths. If it is streamlined, if it is there, then we can have this mandated option that you have to donate the organs. There should be proper motivated system for that. Then using the high risk donors, that if we come to know that the person is in the high risk, so it is very highly sensitive that the person is going to die. In those cases, we may select it. We may take the selection of those patients and we may take prior consent, and according to the death of the person, we may plan for the donation. In this way, we may increase the pool there also. Then another improved system is the opt-out system, where the every death is supposed to be opt-in, means they are consented. It will be because in the cases where where road traffic accidents are happening at a very far side, at those places we cannot reach out easily, and also there is no one to identify those persons. When he is brought into the hospital, there is no one person to consent on his behalf. So the identification process and making the consent process the waste the time of for the organ donation. So in those cases, it shall be assumed that there will be the opt out system, where the person those person who are dying, it is all are opted in for the donation purpose. This shall be the thought. And then if someone doesn't opt out for it specifically, then their organs, if they have been certified death, then they may be taken without the consent or waiting for the relatives. This will increase the pool of donors very hugely. Then, as we already talked, we can inculcate the medical legal cases. We can improve the medical legal qualities and medical legal laws and challenges that I will be talking. By that, we can improve the pool of the donors in the medical legal cases. Then the financial incentives may be the another way to increase the pool of the donors. We can ask for some financial incentives that will promote for the organ donations. Then the social incentives, some social benefits might be given to the donors. They may be awarded, they may be given some sort of the certificate or recognition or some prizes. Like that, social incentives might be given. Then the increasing the living donors at the lifetime only, we may take the consent, we may take out the persons, reach out to the peoples and ask for their donations, and we have the already pull of the list of the peoples who are willing to donate in case of their sudden death or in case of their issues with the life. In those cases, they may opt in voluntarily, and in that way we can increase the pool of the donors ethically. Then to improve the organ donation system in India, we must look at the other countries, those developed countries who have the better organ donation systems. Like you may see the Spain, that is the leading in the world in the organ donation and the transplantation. So what is good in the Spain that shall be learned. So at the Spain, it is the opt-out system that is available in the Spain. In the Spain, a person declared dead who has not been previously expressed a contrary wish or even discussed the issue of organ donation is considered to have given implied authorization for the organ removal. This is called opt-out system. Means it is implied that you are in for the organ donation and your organs will be taken if you are dead. So in this way, they have improved this organ donation system in the Spain region, and people are also voluntarily involved in the organ donation because of the various other regions that I will be telling you. There is a long-term continuous governmental commitment and the support for the program. The government is very committed and they are working on it to keep it maintained. Then there is a comprehensive legal framework system. For purely legal standpoint of view, all the Spanish systems, from a purely legal standpoint, all Spanish citizens who have not specifically stated their unwillingness may be considered for the organ donation. However, in the clinical practice, donations are only pursued after the family consultation and the approval. So to support this opt-out system, there is a proper legal framework in the Spain where if there is no explicit no, then it is opt-in, and in these cases where there is a relative and everyone is available, in those cases they have to ask explicitly that you want to donate or not. They may deny at that time. Whereas if the person is found unknown, if there is no one to claim his body, then it will be assumed that he is opted into the organ donation. In this way, they have streamlined their legal system. So they have legal support for that. Then the policies in place that nurture a culture of trust and confidence in the organ donation and the transplantation program. Then institutions specifically dedicated to donation and the transplantation are developed and maintained on the national, regional and the hospital levels. So they have the developed infrastructure. Continued quality assurance has been identified as a core strategy of the Spanish program. There must be no financial barrier to organ donation or the participation in the transplantation activities. Broad public measures, specialist policies must be developed to prevent the end stage organ failure. So they have improved quality of the medical care systems and all the transplantation and all those systems. Then Spain is currently applying strategies that facilitated disease donation to improve rates of the living donation. So they are working on both living donations as well as the disease donation. Then the tailored trainings for the professional will provide the essential skills and notably those needed for the family consultation. So the skill development programs in the organ donation in all sorts of the coordinators and all those are involved. There is all the programs available. Then they foster a culture of innovation focused on the strategy, technology and the law. Expanding the organ donation after the circulatory death has been identified as an important strategy to increase the donor pool. Advanced donation after the circulatory death protocol have been implemented that are supported by the comprehensive legislative reform and the clinical guidance. So here you can see they have improved this brainstem death certification with the donation after the circulatory death. So that has the legal legislative reform for that. So this has decreased their time interval between the death and the practically donation of the organs. In this way, they have improved the quality of the donations. They are able to lead the world in the organ donation. So these are the practical approaches that can be learned from the Spain. Then what we can do to improve the organ donation, particularly from the medical legal cases in India. So the first of all is that we overcome those challenges that are already challenges in even the medical cases. Once we are overcome with those challenges, then we can bring certain legislation, particularly for the medical legal cases, that can further augment the organ harvesting for the transplantation in India. There is no conflict of interest involved with these suggestions. Anyone can utilize those suggestions if it is suitable for better utilization of the organ donation system and improvement of the organ donation systems in India. To improve the organ donation system in India, we may bring certain legislative reforms like the rules for preserving the unknown bodies for 72 hours can be flexed, particularly where organ harvesting is feasible. So where the organ harvesting is possibility, in those cases we may plan for the not preserving the body for the 72 hours. We may also improve the identification system. We may channelize everyone with the Aadhaar card and everything, so that there is a very rare possibility that unknown deaths happens and we may identify the person with their fingerprint and identification, other identification mark. We can have the record of the electronic records. By this we can have the less possibility of the unknown persons. Then another thing that we can do to improve the organ donation system in the medical legal cases, that may be that the 3 set of vehicles had rust at the accidental site. Then another improvement that we can do to improve the organ donation system in the organ donation cases, particularly the most of the medical legal cases where there is a possibility of organ harvesting, is the accidental deaths. So in cases of accidental deaths, we may send 3 sort of the vehicles. Like the one vehicle will be the mobile autopsy van that will carry the physician and the forensic doctor with his team for the postmortem examination, and the doctor and along with the forensic expert, they will certify the person brainstem death or the circulator system death, and that is the convenient and the practical that is to be developed if after the modification that we improve the brainstem death certification system. Then once the person has been certified dead and the autopsy person goes there, they will conduct the autopsy as whatever is required, they will do that there, and they can move ahead. And there will be second team that will be a mobile organ harvesting van. So with the required specialists to preserve the useful organ in the suitable condition for the long storage and the transplantation purpose. So at the same time, autopsy will be done, and the organs suitable for the harvesting may be taken out by the organ harvesting team, and they will preserve the tissue is properly, and it will decrease a very huge time, and we can immediately after the death we can plan for the organ harvesting. And the third van will be the mobile trauma care van, who shall rush immediately to the site, who will examine the patient. If he is found to be all right, there is no issue, then he is live and surviving, then he may, according to the triage basis, he may consider the patient to send to the hospital or immediate care or in the side care, whatever there is required. They will do this mobile trauma care van perform these procedure. So there can be all the things can be performed at the on site itself. So this will decrease the time gap that is involved in all the procedure that is currently there. Then additional possibility that can be added is because the police has also to reach there, and the policing system is very poor in our country. And as we already see the situation with the police system, they are reaching on the site very late, and there is a very delayed service. So in those particular cases where the feasibility of the organ harvesting is possible, so the doctors are the best person who will understand the essentiality of the time. So in those cases, a modified medical examination system may be developed, that in such cases giving investigating powers to the forensic doctors, particularly in such cases, so that the doctor himself will inquire and investigate the crime scene matters, and the reporting given by him will be taken sincerely, and there will not be any dispute of whatever he is reporting. The case may be transferred later for the other matters to the other investigating officer, that is another matter of the concern. But for that particular place, investigating authority or the management of whole scene may be given the responsibility to the forensic doctors or any other deemed suitable person, whoever the efficient system considers, may be given the responsibility. But I suppose that forensic doctors could be the best possible person to utilize for this purpose. So this power, additional authority may be given to them, and this will improve the system. Then, as I already talked about the brainstem death certification, although this is a very debatable topic and there may be the views against and the for it, but this is just a suggestion that the brainstem death certification rules need to be modification, because practically, as I already told you, practically it is not being followed. Then just for the purpose of organ donation, because it is under the legislative reform and acts, so this tedious process is being followed. So the way the Spain or the other countries have devised the concept of circulatory death, likewise we can think in that way, and we can improve the death certification system, and this will save a lot of time. So brainstem death certification rules need modification and to be made more practical, convenient and suited for the organ transplantation purposes. For that, a single doctor or two doctors, general physician and forensic medicine, who is rushing immediately to the accident site. For that matter, a single doctor or the two doctor, general physician and the forensic doctors who are rushing immediately to the accident site must be qualified. Then another thing that can be done is the updating all the human database of the country with the Aadhaar like system, and the death will associated with that. This will solve the major issues of the identification and organ harvesting in the unknown cases. So there will be all the details attached with the Aadhaar system. Identification could be possible with fingerprinting, corneal scanning. So he may be identified, and there will be the death will attached with that what exact procedure shall be done in that particular cases. So even though there is no known person to him, then we can know that what is his death planning. So a planning of death shall be death will, that is concept that came in cases with the death will that came recently with the Mental Health Act and with the Supreme Court judgments, where the living will, where the person decide whether he should be resuscitated or not, and what sort of treatment shall be given to him. And for the Mental Health Act as well, this advanced directive came into picture. So all those sorts of things may be applied here also, where he will in the living where in the during his lifetime only he will state what shall be done with his body, how he shall be cremated, how the organ donation or all those systems shall be done. All this shall be written as All these shall be written and documented as a form of death bill or the living bill, and that may be utilized or attached with the Aadhaar like system, and there is no need of the relatives consent or his consent in case of the deaths with him, and we can plan for the utilization of the his organs, and we as well as we can fulfill his death dreams or his demands associated with his deaths. So in this way, this new concept could be in this way, this will again solve the issue of the unknown bodies and the organ donations associated with such cases. Then the uniform procedure of medico legal examination system in all states of India shall be there. This is the need of the hour. This will also help to overcome the interstate transfer of organs for the transplantation. So a streamlined system of the medico legal investigations and the permission and all those should be there throughout the country. This will improve the organ donation pool from the different states, and this will improve the organ transplantation tremendously. By applying all those factors, we can improve a lot in the Indian context about the organ transplantation, particularly in the medico-legal cases. So this is all related to the organ transplantation with respect to the road traffic accidents or other sorts of injuries or the unnatural deaths. To conclude, finally, the differences in the frequency of the transplantation between the countries suggest that there is a lack of room for the improvement. To conclude our entire discussion, the differences in the frequency of transplantation between countries suggest that there is a lot of room for improvement, wherein countries with the low transplantation rates could learn from the experiences of the countries that are doing well. Efforts to increase transplantation rates require a variety of strategies, including approaches to increasing the living and the disease donation, improving the coordination of the donation and intensive care unit processes, increasing graft quality and optimizing expanded donation criteria. Education should cover the complete spectrum of society, the general population, patients and the medical professionals, with special outreach methods to unrepresented communities and individuals who are health illiterates. Recently, Turkey has achieved exceptional rates for the living donation through a combination of financial commitments, education initiatives, and the integration of the private sectors. These all can be applied for our system as well for both living and the diseased organ donation. In this way, we may improve our system of the organ transplantation. This is all. Thank you for your time, for patient listening. Best wishes for your career. Thank you so much.